Good afternoon, everybody. I am Dr. Misty Paul. I'm a chiropractor and owner of Basics First Chiropractic. We're located in the Northern Virginia area in Leesburg. And for those of you who may be local, we are in the Wegman Shopping Center in the village at Leesburg. So thank you so much for joining us on Wellness on Wednesday. Wow. So I hope to be able to wow you today with some facts. And today we're going to be talking about sleeping. So I have my notes in front of me, and you're probably wondering why I might have a tape measure around me. So chiropractors are not tailors, but we do like to measure. And one of the things that we like to measure is the neck area. The neck from the back of the ear to the shoulder, and then from the back part of the head down to the mid back. And the reason that we do that is to be able to find a good pillow for you. As you know, people come into our clinics with neck pain, headache, tension, and tightness in their shoulders. And all of this can be easily alleviated with good chiropractic care in our clinic. But we also like to talk about a good fitting pillow for you. So today I'm asking you, what kind of pillow are you sleeping on? Behind me, you see the pillows that we use. They're the PillowWise brand. I'm going to get one out and I'll share with you a few facts about neck and the kind of pillows that you may need. You're not obligated by any means to use our pillows. However, these are some things that you can check for. So first of all, our neck, when you look at it from the side view, is supposed to have a nice backward C curve with the ear sitting gently over the shoulder. But because of the kind of work that many of us do, sitting at a desk, driving for long periods of time, certainly as a chiropractor being bent over patients, dental hygienists in the strange positions that you're in, students also, and the technology that we're using, we're becoming very much head forward. So two things are happening. There's a lot of tightness in the back part of the neck. There's shortening of the muscles in the front of the neck that's pulling the head forward. And this in itself is creating tightness of muscles, giving us neck pain, headaches, even jaw pain, pain around the eyes, but also our nice backward C curve is becoming straighter. And that's a bad thing because when that curve in the neck goes away, then there's greater pressure on the discs and consequently greater pressure on the vertebrae. And you're setting yourself up for early degeneration, which none of us want. So at some point, when our patients come in, of course, we initially start out with the orthopedic exam. We'll recommend treatment. We'll begin good chiropractic care. And then at some point, we'll start talking about the kind of pillow that you're using. Because there's some of you that don't like pillows at all, or maybe using a thin wafer pillow, and unknowingly, this is what you're doing to your neck. You're straightening out that curve even more, and the muscles are becoming even tighter. You're possibly waking up with a great deal more neck pain, or the other people are sleeping with too many pillows or too high of a pillow. So they're promoting or increasing head forwardness, and the same thing is happening with the tightness of muscles. So at that point, when you come in, the three of us doctors at Basics First are quite experienced in pillow fitting, but if necessary, we'll measure you. We'll measure you from the ear to the shoulder and down your back to see which size of a pillow you would require. The pillow that we have, the PillowWise pillow, you'll see has a curve in it, but it's a nice gentle curve. Some people out there love the down pillows or the down alternative, but that they might be too soft. and other ones are at the other extreme. They may be too hard. The reason that I love these pillow-wise pillows is that they're a nice comfort level for the whole spectrum. And this curve is supposed to help support your neck. So we'll fit you, but we'll tell you to start out by possibly sleeping on the less of a curve first to get yourself adjusted to that support. And then as you become more comfortable, we'll move you to that part of the pillow with a greater curve, and that way you'll actually be rehabbing a nice curve into your spine as you're sleeping. How great is that? We talk about rehab while we sleep, right? And that's how it's supposed to be. Let's talk about positions of sleeping. So sleeping on your back or on your side is better for you. Sleeping on your stomach is about the worst thing you can do for your neck. So many of us, when we're sleeping on our stomach, what happens is we have to turn our neck one way or another to be able to breathe. You don't keep your face down when you're on your stomach, and that creates tightness all through the night. So I like to tell my patients, sleep on your back, make sure that pillow is well giving you that support that you need to keep that nice curve in the neck, and then put an additional pillow underneath your knees, just a small one, like a small cushion from your couch, perhaps. It doesn't have to be a big pillow. And the reason for that is that gentle bend in your knees will take pressure off of your low back. If you're a side sleeper like I am, I like to make sure that my neck is well supported on the side, so I'm not bending too much this way or that way, but rather keeping myself in the position that I need to be in. And then I either put a pillow between my knees to keep my hips aligned, or I keep a pillow in the front of my legs so that I can bend one knee and put it on that pillow gently, again, making sure that my knees are well aligned. Just looking at my notes to make sure that I'm covering everything. Let's see. So the other thing that I'd like to mention about the pillow is that when you start using a new pillow, it's new for those muscles. It's almost as if you're doing new exercises that you're not quite accustomed to. It's okay in the middle of the night to take away the old pillow and use your old, take away the new pillow and take up the old pillow and put that under your head until you've had a couple of days to get accustomed to that new support that you're feeling. It's, again, not unusual for our patients to say in the beginning when they started using a new pillow, oh my goodness, my neck hurts a little bit. That should subside, and the new support will actually help you out greatly. I hear all the time, once our patients start to use the correct fitting pillow, how well they're sleeping at night. And because they're having less neck pain, less tension. And of course, that means that we don't see you quite as often in the clinic, which is a good thing. It's good to be able to show you ways of taking care of yourself at home. The other part of sleeping at night is that we need to be getting a good 7 to 8 hours each night. It is such a crazy, busy life that we all lead. And I know that most of us feel that there aren't enough hours in the day, that we want to work into the wee hours of the night. Please stop yourself from doing that. Set a bedtime. You know, when our kids are young, we make a bedtime routine for them. It's just as important for us to have a nice bedtime routine. Clearly, people are just not getting adequate sleep. It's increasing the tension that they feel. We're starting to learn that not enough sleep at night leads to chronic inflammation, heart disease. It increases our risk for diabetes, and it's just, we feel fatigued. So I like to tell my patients, please start setting a regular time when you start to wind down, just like you would tell your children. So if your normal bedtime may be 10 o'clock, then the hour prior should be your wind down time. This is the time to turn off your phones, turn off technology, even turn off the TV. Maybe make yourself a nice cup of tea. Not anything that has caffeine in it, but rather herbal teas are great. And it's nice, it's soothing. It's just starting to set that nighttime routine. I love using essential oils in my clinic, and the one that I love to use for nighttime is Serenity. Serenity essential oil is a blend, and it's a blend of many different essential oils that are perfect for helping us become more calm, relieve the tension, and relax. And lavender is one of those oils that's in here, along with many other ones. But it is the lavender, and we all know, we understand that lavender helps us relax, and that's exactly what it does. So for me, when it's my bedtime is 10 o'clock. So at 9 o'clock, I'll start by making myself a nice cup of tea. I'll start turning lights down low. I'll turn off technology, and I'll put a little bit of Serenity essential oils, a couple drops in the palm of my hands. I'll take 3 nice deep breaths, and I'll put the rest around my neck and my upper chest so it can diffuse up. I like the smell of it so much, and it is helpful in relieving the tension of the day and relieving the chatter in my mind. I'll put a couple drops on maybe a Kleenex or a cotton ball, and I'll put that cotton ball or Kleenex into the pillowcase. So then as I'm laying in bed, I'm still getting the smell of that. You'll be surprised at how long that smell stays with you. It's really fabulous. The Serenity essential oil that I use also comes in soft gels, and the soft gel is just so perfect. The dosage is up to 2 a night. It's non-habit forming, and the main components of it are lavender and L-theanine, both great for helping you fall asleep and helping to decrease that mind chatter. You know how it is, that to-do list keeps on going in our mind. So I'll take 1 to 2 an hour prior to bedtime, along with my cup of tea, and it just helps start my mind into that soothing frame of the day. And it leaves me feeling refreshed in the morning. It does not make me feel groggy. It's not habit forming. And I'm just looking at my notes again. I think I've covered everything I want to tell you about that essential oil too. I really hope that you've enjoyed our tips for Wellness on Wednesdays. I hope you've been wowed. Please come back and join us again every Wednesday when I'll join you on a Zoom call from 12:30 to 1. And when you're here with me, we can open it up to questions. And if you have something that you'd like me to discuss, please be forthcoming with your questions, and I'll be happy to answer them the best to my ability. Thank you so much.